Hello and Happy New Year. Welcome to our first webinar and first participant forum of the year. Today we'll be covering the draft new and updated operating rules for the final core vote that's ongoing and answer a few of the questions along the way. So we'll start off with a background on the CAQH core voting process before diving into a detailed review of each of the rules up for ballot. And finally, we'll end up with a Q&A as well as next steps. You can download the presentation slides right now from the handout section of the GoToWebinar menu. You can also download the presentation slides and recording on the CAQH website. They'll also be on the participant dashboard. And if that's not enough, we'll also send you a copy of the slides and the recording within the next couple of business days. If you have any questions or technical issues, please use the questions panel on the GoToWebinar dashboard on the right. So I'd like to give a big and warm thank you to our speakers and co-chairs, Donna, Molly, and Mahesh, who've helped spearhead all of these rule efforts and are joining us today to give an overview of the different rules. And we're also joined by Aaron Weber and Bob Bowman, CAQH CORE directors. So with that, I will turn the call over to Aaron.
Thanks, Stephanie, and thanks everyone for joining us today. This is a call for participating organizations only. Many of you or members of your organization have been involved in the rule development efforts we have had throughout 2021 and even prior to 2021 to bring about some new and updated rule requirements for our operating rules. So I'm going to walk through just the background and a little bit of a reminder on our voting process and how things work here at CAQH CORE, and then the rest of the team is going to provide an overview of the new and updated draft rules. So CAQH CORE has a formal rule approval process that we have been going through since the beginning of requirements development. The first level of that process is what we call the subgroups and the task groups, which are responsible for developing and drafting the rule requirements or updating the rule requirements. So that process we have completed last summer. The next level is the work group ballot. And so that is the efforts of the review work group, which has been meeting throughout the fall to review the efforts of the subgroups and task groups. There are quorum and approval requirements at this level. Quorum of 60% of all organizations participating in CORE must vote, and then there's a majority vote needed to move the rule forward. The stage that we are currently at is what we call level 3, the final CAQH CORE participant vote. And this is the stage at which all full CORE voting membership organizations, and those are organizations that create, transmit, or use administrative transactions. All these organizations vote with a quorum of 60%, and then a 2/3 approval is needed to move a rule forward. Just a reminder for those that may be newer to CORE, this concept was developed when CORE was first founded because it's these organizations, the providers, the health plans, the vendors, and the clearinghouses that have to update their systems and invest resources to implement the rules. So it's really important that at this level, those organizations that have to commit to using the rules have a key say in their development. So you should have received, as a CORE participating organization, the ballot for the final CORE vote on Monday of this week. And that ballot is due on January 26th. So you can use the information you gained today. You can always reach out to CORE staff if you have questions, but we do ask that you cast that ballot by January 26th. And just a reminder, I'm sure someone will say this later, but it is one vote per organization. So if multiple individuals from your organization have been participating in the effort, we just ask that you coordinate to submit one single vote. And then the final stage in the CORE voting process is the CORE board's review and vote on the draft rules. The board is meeting in February under the assumption that the rules move forward at this point. If the board does not approve the rules for any particular reason, and this happens at any stage, right? If a rule is not approved, it will be sent back to the prior level to revisit any challenges identified with the rules. Just a quick reminder here, the core board is composed of providers, vendors, and health plans, 5 providers, 5 vendors, I'm sorry, 5 health plans and 3 vendors. So nothing moves forward at that level unless there is agreement between the providers and the health plans. Next slide, please. A lot of work has gone into the rule packages that we will be reviewing today. There are 4 sets or packages of rules that will be included on the ballot. The first are 2 new sets of attachments operating rules, one for prior authorization and one to address healthcare claims. You can see that we had a lot of participation and engagement in this effort going all the way back to the middle of 2020. There were many calls, many feedback forms, many straw polls that I know you all spent time working on that have led us to these draft rules. So much of our work is well vetted at this point, and we have had feedback and engagement from over 50 organizations. Also, last spring, we launched a task group to update the Eligibility and Benefits Data Content Rule. That rule was initially developed probably over 10 years ago, and industry has identified several areas where there were needed updates to basically align with emerging business needs. And so that task group met and ultimately agreed on a set of updates, which we'll review today, which were then reviewed by the review work group this past fall. And finally, another area where we heard quite a bit from the industry and the core participants and the core board about the need for updates were related to the infrastructure rule requirements. And all of the CAQH CORE infrastructure operating rule sets, all of the CAQH CORE operating rule sets include an infrastructure rule, and those are requirements like system availability, companion guide, response time. And so with a focus in particular on the system availability and response time requirements, we did a participant survey over the summer to understand where there were needs to update these rules, again, to align with today's business environment. And then the review work group worked through a set of proposed recommendations to ultimately come up with some updates to that system availability requirement. At each stage throughout this process, the core board has been briefed and updated on the status of the work. Next slide. So this slide is really a summary of where we are today and what will be included on the final, or what is included on the final ballot. So the rules work group throughout this past fall further refined and reviewed all of these rules that I just walked through and completed their ballot right before the holidays. So of the 4 items included in the ballot, the first listed here is the attachment prior authorization operating rules. That set of rules received 86% support on the rules work group ballot, and I showed the quorum and approval requirements for that which was a 50% approval requirement. So this, all of these rules far exceeded that requirement. The second item on the ballot will be the draft attachments healthcare claim operating rules, and those received 83% support on the rules work group ballot. Third are those updated draft eligibility and benefit data content rule requirements, which received 87% support on the rules work group ballot. And finally are the updated infrastructure rule requirements for system availability, which received 83% support on the rules work group ballot. I'm now going to turn it over to my colleagues who are going to talk through the detailed requirements in each of these new and updated draft operating rules. And Bob will kick it off with the attachments work.
Great, thanks, Aaron. And just as Aaron mentioned, we do want to kind of level set a little bit on the draft operating rules for attachments, because we did have two sets of rules come out, one for a prior authorization and one for the healthcare claim. So if we move over to the next slide, that would be slide 10, you can see, just as Aaron mentioned, that we did do quite an extensive environmental scanning, industry surveying, and we launched a specific advisory group for attachments. Many of you may have participated in that process. Again, every core participating organization was invited to participate in that survey, as well as many of you also were part of our interviewing panel. Some of you even were members of our advisory group. Again, we worked extensively with that group to identify key potential opportunity areas to develop operating rules for. It went through quite an extensive analysis before we actually launched the individual subgroups that address both PA and claims. We did divide those because there may be, and there were, some nuances that we needed to consider for each of those specific use cases. So those individual subgroups drafted specific requirements for each of those use cases, and each of those sets of operating rules then went to the review work group, as Aaron mentioned. And now they're into the formal voting ballot for the all-core vote. So as you can see, this has been a many months long process to develop this set of operating rules and many different sets of review. As you can see there, there were 15 advisory subgroup and work group meetings, several straw polls and ballots, and also received greater than 50% support on the review work group ballot itself. Moving on to the next slide, on slide 11. Again, just as an overview, the rules that were developed by the different individual work groups really looked at very specific things, right? Those potential opportunity areas that we initially identified months ago really distilled down to very specific key infrastructure and data content requirements. Again, we don't boil the ocean. We don't do everything that everyone wants. We really have to build consensus. And so we look at those specific items that cause perhaps some of the biggest pain points in the exchange of the data. So we address those infrastructure requirements. And also, are there key components related to data, either within the standard or within a transaction or within the attachment itself, right? That is causing some of the abrasion that we see. And so we look and we identify those, we address those, and then we drive to consensus to remediate those issues. So you can see we looked at very specific requirements, and those requirements broke down into a couple of different categories or buckets. You see that there are, again, standards exist kind of all over the place within the industry today. So is there a standard that we need to address? Yes, there probably is. Or there's some process that we have to take to consider other standards that may be in development or in use or in small limited use. We know that there are differences between prior authorization and healthcare claims, so we have to look at those nuances as well. Again, looking at specific draft infrastructure and data content requirements, we look for those key issues that we're trying to address. And so we need to identify those and also make sure that we're working with the industry to understand that, again, we're not trying to resolve every single potential issue or every issue that exists, but we as a group, as a core participating body, these are the ones that we can address. And so we look at those types of items specifically to make sure we can address those in a cohesive manner. Moving over to the next slide, on slide 12, you see that we broke these out into different types of operating rules. They address two different specific scenarios, one that uses an X12 transaction, the 275 transaction, and one that is a non-X12 method. We know and recognize that the industry has quite a variety of transactions or interactions that exist today. So we don't want to force folks to migrate from one to the other, but set up really an environment or a system that allows providers to choose vendors or clearinghouses or applications on their end that can accommodate their business need. And also health plans can support those business needs of providers as well as their own business needs. So some are all in on the 275, others haven't the first implementation of the 275 in mind yet. So how do we as a consensus-driven body, identified those pathways to ensure that there's uniformity, consistency, so that application vendors, clearinghouses, and the providers and the health plans on both ends of that interaction can actually make progress towards uniformity, consistency, and therefore get the benefits of using consistent operating rules between transactions, technology, and the data that's needed to actually be exchanged. So again, we set up the process to do just that. So we look at our payload exchange method. We have a specific connectivity that we've developed to accommodate both the 275 method and the non-275 method. We look at the payload format, in this particular case, the 275. And we also look at the payload type. And you see here a whole list of them, right? Because most of the time, our operating rules are payload agnostic, right? Our connectivity is payload agnostic. If we do have a payload format, we'll have specific requirements around that. But what can sit within a 275, right, within that cardboard box of a transaction really could be anything, right? It could be a CCDA, it could be a PDF, it could be a JPEG, it could be a Word document. So that cardboard box of the 275, probably not the best analogy, but it allows for the multiplicity of payloads to actually be part of it, right? So hopefully that lays a foundation for how we came to these specific requirements. Now I'll hand the call over to Mahesh. We'll dive down a little bit deeper into some of the specific detailed requirements of the transactions related to PA and claims. Mahesh?
Thanks, Bob. As Bob mentioned, the process to develop the requirements for the attachments operating rule was incredibly robust. It involved many of the folks on the call today. We'll transition now to the details of the draft attachment operating rules, starting with the prior authorization use case. Starting with the summary of the draft requirements for the infrastructure rule, you can see that they are broken down into requirements that apply only to X12 method and the requirements that apply when using either the X12 or the non-X12 method. As your organizations review the draft rules in preparation for the ballot, the X12 method and the non-X12 method will be separated into two distinct sections. Since some requirements apply to both methods, they will be duplicated in the draft rule. You'll also notice that all the requirements listed on this slide align with the infrastructure requirements in the existing core infrastructure operating rules, with the exception of file size. Requirements that apply only when attachments are sent using an X12 275 include processing mode, companion guide, acknowledgements, and data error handling requirements. In alignment with the core prior authorization 278 operating rule, the processing mode requirements included in this rule specifies that the health plans must implement the server requirements for both batch and real-time processing modes for the X12 275. Next, as with all core infrastructure rules, if a companion guide covering the X12 275 is published by an organization, it must follow the flow and the format defined in the core master companion guide template. The last of the requirements that apply only when using the X12 method are acknowledgements and data error handling. The draft rule requires health plans to use the X12 6020.999, the version 6020.999, when an X12 275 is received, regardless of if there is a processing error. There are additional requirements for the return of an X12 824 if a health plan responds to errors at the initial data content processing layer. The requirements in teal on the right-hand side of the slide are found in both the X12 and the non-X12 sections of the rule. The first draft requirement is for system availability. The rule specifies the weekly system availability, but no less than 90% per calendar week, and also include the option of 24 additional downtime hours per calendar quarter for larger system upgrades. This requirement applies to all core infrastructure rules for consistency, and we'll hear more about the decision to adjust the system availability to 90% per calendar year the infrastructure update section of this presentation. Again, as with all the core infrastructure rules, this rule requires the use of core connectivity version 4 for both the X12 and the non-X12 method. The final infrastructure requirement we'll review establishes a minimum file size of 64 MB. This means that entities must be able to accept at least 64 MB of data to ensure attachments can be processed across varying systems, including front-end servers and internet document management systems. Throughout the rule development process, there was much discussion around the requirement, including discussions to establish the maximum file size, but it was determined that, as with all core operating rules, the file size requirement would establish a floor and not a ceiling in terms of what entities must support. This means that entities can accept more than 64 MB if they choose, but we chose to go with the floor. So now keep these requirements in mind as we reference them again when we transition to the attachments claims infrastructure rule in a few slides. Going to the next slide, the focus of the data content rule is to address a pain point highlighted throughout the rule development process, connecting an attachment with the original prior authorization request or claim submission. As with the infrastructure requirements, the attachments, prior authorization data content requirements fall into two buckets: those that apply to the X12 method only, and those that apply when sending additional documentation using the non-X12 method. For the X12 method only, when an X12 278 response is pending, health plan must use the PWK02 code EL to request an electronic submission of additional documentation. Similarly, providers must use PWK02 code EL, the X12 278 request, to notify health plans that additional documentation is being transmitted electronically. Providers are also encouraged to send metadata and/or reference identifiers identified in the draft rule while sending an X12 version 6020 to 75 for ease of reassociating the attachment to the original prior authorization, though it is not a requirement. For the non-X12 method only, providers should indicate that the additional documentation was sent and specify the attachment body using SOAP or REST headers as specified in the core connectivity version 4. Providers should also send the data identified in the draft rule as part of the non-X12 payload when sending additional information to assist with reassociation, though this is not a requirement. Going to the next slide, slide 16. We'll now transition to the details of draft attachments healthcare claims rules. Next slide, thank you. The attachment claims infrastructure rule requirements mirror the infrastructure requirements established in the draft attachments prior authorization infrastructure rule that we just reviewed in slide 14, including system availability, companion guides, acknowledgement, data error handling, and processing mode. However, there are two requirements that are unique to the healthcare claims infrastructure rule that I want to highlight. The first unique draft requirement is an additional file size requirement that applies only when using the X12 method. You'll recall that the file size requirements were already discussed, establishing a 64 MB minimum file size that front-end servers and internal document management system must be able to accept. The additional file size requirement included in the attachments claims infrastructure rule specifies that if a provider uses more than one LX loop to submit multiple attachments, the health plan must support the capability to receive multiple attachments, LX loops, per the X12 275 for one healthcare claim submission. Throughout the development process, there were discussions as to whether the file size minimum applies to the entire 275 transaction or per the LX loop. After much conversation on the topic, the group determined that the 64 MB file size minimum applies to the entire X12275 attachment, not per the LX loop. The other draft infrastructure requirement unique to attachments for healthcare claims establishes consistent electronic access to attachments policies and applies to the X12 method. The draft requirements necessitates that health plans attachment policies must be accessible electronically in a consistent location, such that the such as the health plan web page. Moving to slide 18. Similarly, the draft attachment healthcare claims data content rule requirements mirror the data content requirements established in the draft attachments prior authorization data content rule. There is one unique requirement in the rule specific to the reassociation of an attachment to a healthcare claim submission. The rule specifies that health plans should use the appropriate loan code on an X12277 RFAI request for additional information to request the most specific additional information needed to support a claim submission. It is important to highlight that the health plans are not required to utilize the 277 RFAI to request additional information. The requirement only applies if it's being used. Transitioning to slide 19. As you've heard throughout the deck, the draft attachment operating rules really target key issues in the attachment process. As mentioned, some of these issues include unnecessary back and forth between providers and health plans, manual follow-up by providers to ensure attachments were received and linked to the original submission, and inconsistent use of attachment standards, that Bob mentioned about, right? The benefits of the draft rules are numerous, but some of the key areas that we want to highlight include that these rules, address attachments sent using the X12275 transaction and additional documentation sent without using the X12275 transaction. This is critical to addressing interoperability between administrative and clinical data within the industry and closing workflow loops. The other benefit is that it establishes key infrastructure requirements that align with existing core infrastructure rules and providing the necessary information to uniformly send electronic transactions. Additionally, the benefit here is it requires specific codes and reference data to simplify reassociation, which is a major pain point, for our providers and health plan throughout the development process. Lastly, this provides additional guidance to communicate data and processing errors to limit follow-up from providers as to whether attachments were received and all the information necessary was included. With that, I'll hand over the presentation over to Molly from AMA to discuss our next topic.
Thanks so much, Mahesh. I will now provide an overview of the updated draft infrastructure operating rules. So moving forward, starting off with some background on the core infrastructure rules. Each set of operating rules includes an infrastructure rule that has requirements for processing mode, response time, system availability, connectivity, acknowledgements, and companion guides by transaction. This infrastructure rule update was initiated following feedback from industry and the CAQH CORE board that there was a need to adjust and align with updated technology and evolving business needs. So building from this, CAQH CORE participants were surveyed back in September 2021 to gauge support for updating system availability and response time requirements across all rule sets. And these findings were reviewed and further vetted by the CAQH CORE review work group. Next slide, please. In the survey and review by the work group, clear consensus did emerge across all 8 infrastructure rules, but significant discussion occurred related to specific system availability needs. And there was clear consensus to update the system availability requirements. Ultimately, the review work group participants compromised by recommending a new quarterly system availability requirement to accommodate large system migrations if weekly system availability was increased above 86%. So the work group participants did agree to make substantive adjustments for all infrastructure rules by 1, updating the weekly system availability to 90% per calendar week, and 2, adding a new quarterly system availability requirement that would allow health plans and their agents to use 24 additional hours of system downtime per calendar quarter. This is for system migrations, mitigation, and more integrated system needs that may require downtime in excess of the allowable weekly system downtime. These updated requirements received 83% support on the review work group ballot. And please note that the processing mode response time requirements were not updated as consensus was not reached there. The requirement remains at 20 seconds for real time, and they vary for batch processing according to use case. And so the last area to review for the updated infrastructure operating rules are some non-substantive updates. These are changes made across all infrastructure rules to references to the CAQH CORE connectivity rule and changes to the CAQH CORE master companion guide template. So for connectivity, all CAQH CORE infrastructure rules were updated to reference the quote, most recent version of the CAQH CORE connectivity rule. This means that by January 2023, CAQH CORE connectivity version C4.0.0 will be required for all CAQH CORE infrastructure operating rules. This is because core certified entities will be required to comply with the most recent version of the core connectivity rule within 2 years of publication. And secondly, for the companion guide update, companion guide references to specific X12 versions will be modifiable. Each of the CAQH CORE infrastructure rules requires use of the core master companion guide. And as the companion guides are currently written, they're to be used in tandem with the version 5010 ASC X12N implementation guides and are compliant with both ASC X12 syntax and those guides. However, as new operating rules have been written, not all operating rules will use the version 5010. So attachments, for example, uses the 6020. To align with this need, references to a specific X12 version will be modifiable in the CAQH CORE master companion guide. And with that, that actually sums up the substantive and non-substantive updates to the core infrastructure rules. So I will go ahead and pass it to Donna.
Thank you so much, Molly. So for level set, we're on slide 24, for those of you following along on the go-to. The last ballot item before returning to CAQH CORE staff is to review the draft CAQH CORE Eligibility and Benefits Data Content Rule updates. The present day CAQH CORE Eligibility and Benefit Data Content Rule requires the submission and return of certain uniform data elements in real time for electronic eligibility, coverage, and benefit transactions. Within this existing rule that's in present day, the data content requirements include supporting requests for benefit information at least 12 months into the past and up to the end of the current month, inclusion of patient financials for coinsurance, copayment, and base and remaining deductibles, the return of in and out of network variances for financial responsibility, and the name of the health plan covering the individual for both generic and explicit inquiries. It includes returning core required eligibility and benefit data for 51 specific service type codes. Requires the health plans and providers to uniquely identify patients via the last name normalization. It defines a standard way for health plans to report errors through the AAA or AAA error code reporting requirements. And finally, requires vendors to detect and extract all data elements to which the data content rule applies as returned by the health plan in the X12 271 response. Moving to slide 26, a little background how we arrived here today on this call. We engaged in the process of updating the eligibility and benefits data content rule, which was intensive and detailed and facilitated with and by compromise and consensus. In 2020, CAQH CORE participants identified the eligibility and benefits business process as an area for CAQH CORE to prioritize for operating rule development given evolving business needs. In April 2021, which doesn't seem like it was a year ago, but it's almost a year ago, the Eligibility and Benefit Task Group convened to evaluate opportunity areas to enhance the rule. The task group evaluated numerous opportunity areas and drafted operating rules for those areas. We will review those opportunity areas and draft rules on the coming slides. The task group then forwarded the draft rule updates to the CAQH CORE review work group, where those CAQH CORE voting organizations voted and reached quorum. And then overall, the draft rule updates were discussed at more than 10 task group meetings and work group meetings, over 3 straw polls and ballots, and received 83% support on the review work group ballot in late December 2021. Moving to slide 27. The draft CAQH CORE Eligibility and Data Content Rule update enhances the exchange of eligibility information between health plans and providers through these requirements, including the laundry list now, financial information, especially the coinsurance, copayment deductible, remaining deductible amounts, coverage information for a set of service types in real time. The eligibility task group and rule work group agreed to update the requirements for opportunity areas that were considered high priority, they were codifiable, they were low to medium implementation complexities, and could serve as an interim bridge between the current 5010-270-271 version and the newly published 8010 transactions. Through these discussions and straw polls, the Eligibility and Benefit Task Group agreed to not include requirements related to patient data sharing, ability to respond to eligibility and benefit requests at the diagnosis level, and dental-specific requirements. That was due to the low support for those. The draft rule requirements pertaining to telemedicine and procedure codes were the most discussed during the rule development. For the telemedicine requirements, the draft rule has requirements to align to the now final, it was draft up until last week, RFI, or Request for Interpretation, that X12 published, number 2486. Again, that was finalized last week, so anyone who's searching for it can do so on the X12 website and see the final version. And for procedure codes, the draft rule requirement applies to only a limited set of categories of services. In the rule workgroup ballot, the draft rule received 83% support from the workgroup members, which is good. Moving to slide 28. So that was where we were up until this development cycle and inclusive of what's changed in this new development cycle. We're going to review the updates in the rule in more detail. The updates to the rule fall into 6 categories. The 6 categories, if you're following along, were telemedicine, aka that RFI, service type code support, support from remaining coverage benefits, procedure codes within that limited category of services, prior authorization and certification indication, and tier benefits. Starting with telemedicine, the update addresses emerging needs to communicate telemedicine by requiring the use of the Centers for Medicaid and Medicare Services place of service codes for the professional healthcare claim code 02, which stands for telemedicine, or 10, to indicate what service or benefit is available for telemedicine. The updates add 71 new discretionary service type codes and 55 new mandatory service type codes for a total of 178 core required service type codes. For the remaining coverage benefits, the update supports the communication of the number of visits and services left on a benefit by requiring health plans to return the maximum benefit limitations and their remaining benefits for 10 core required remaining coverage benefit service types. Furthermore, for the procedure codes, the update enhances requirements to respond to eligibility and benefit requests at the procedure level, aka the CPT or HCPCS level, for physical therapy, occupational therapy, surgery, and imaging. The update also requires the communication if a prior authorization or certification is required for a core required service or procedure, or more than one. And then lastly, the rule updates provide more granular level data for members of tiered benefit plans, including coverage status, patient financial responsibility, remaining benefit coverage, authorization, certification status, and in and out of network determination. Also communicates, the requirement communicates the tiered network information for the in-network, out-of-network, exclusive, preferred for that inquiring provider. Moving on to slide 29. We're going to go over the next steps. There, the full CAQH CORE voting participation organization, so more than the ones that have participated in our rule work group or task group, must submit their vote by Wednesday, January 26th this year. You're going to want to, if you're not that person that does the voting for your organization, or even if you are that person, you're going to want to work with the others in your organization to solidify and gain the support for your selections on the ballot that we reviewed today, and submit them by January 26th. If the draft rule passes, the final CAQH CORE vote, the CAQH CORE board will review and vote on the draft rules during the February board meeting. The board's also going to consider whether or not to submit a set of operating rules to NCVHS for consideration for federal mandate. And finally, if the draft rules are approved by the board, the new and updated operating rules will be published in the spring, and testing platform development will begin to support the core certification of these rules. I'm going to pass this back to Daphne, or to Daphne from staff, and let her finish us out.
Wonderful, thanks, Donna. I'm going to open it up for Q&A. I know we have a couple of minutes left on this call. So to quickly dive into it, on the previous slide, we mentioned that there's going to be a set of operating rules submitted to NCVHS this year for consideration for federal mandate. So I'm going to turn it over to Erin. What is the anticipated rule set, and can you provide a little bit more color around that for our participants on the call?
Sure, thanks, Daphne. It's a good question. So anytime the board votes on a new set of rules or updated rules, it's always a consideration, is it time to send a rule package to NCVHS as well? So what the board will do at its next meeting is consider this set of rules, any of the other rules that are still voluntary and not federally mandated, and determine, is there an industry need to forward any of these to NCVHS at this time? So I can't speak to what the package would be. That will be the board's decision, but it could be any combination of the voluntary rules and these new rules coming out, or they could elect not to send a package to NCVHS at this time. So we will certainly update the group as the board works through that decision-making process.
Thanks, Erin. We don't have any other questions coming in right now, but please, if you have any questions during this submission period, please submit them to core@caqh.org or any staff members, and we'll get right back to you. I want to give a final thank you to our speakers and co-chairs, and to Bob and Erin for joining us on the call today, and of course to you all for your support and for tuning in. Hope everyone has a good afternoon.
Thanks all.
Great, thank you.
Thank you. Bye, everyone.
Have a good afternoon. Bye.